Welcome to Dialed In on the Virtual Care Journey with Jeremy and Becca, your trusted companions in navigating the ever-evolving landscape of virtual care.
Hello, and welcome back to Dialed In on the Virtual Care Journey. I'm Becca Bean, and I've got Jeremy Hedrick with me.
Hello.
And today we're joined by David Kemp of MarketScale. Hey, David.
How's it going?
Doing great. So, David, we see you all the time when we're up here filming these podcasts, so it's really great to have you on as a guest.
It's an honor to be here. Thanks for having me.
Yeah, so tell us a little bit about yourself for the listening audience.
Yeah, so I lead the healthcare vertical at MarketScale, and been in healthcare the last 15 years or so. Started out in revenue cycle. That's kind of my home away from home with a company called Med Assets that now might be known as FinThrive.
Mm-hmm.
And we helped large health systems bill and collect appeal denials and get the cash in the door. And so I learned, it was weird. I went from coaching college basketball to working in revenue cycle. And I learned a lot. Great
college basketball to revenue cycle.
Yeah.
Okay.
Yeah.
It's a journey most people have.
It's natural.
Opera
natural.
singer, healthcare.
No way.
Yeah.
Yeah.
Yeah, we can.
Well, you got a mic. You got a
mic. We've been trying to get him to sing
part
for
of
years,
life.
and that's not
different time.
Okay, so sorry.
But it's funny how we do this, right? We like a lot of these journeys are non-traditional.
That's right.
But once you get into healthcare,
they never let you leave.
Most people stay.
No,
Yeah.
it's a small world in this space.
Yeah, it really is. And so from there, just patient engagement, care coordination at Salesforce, and now been at MarketScale about 5 years. But yeah, healthcare is kind of like the land of entrapment. Once you get in, you're not getting out.
That's right.
No.
For good reason.
No, and David's always one of my conference buddies. I think I see you
Yeah.
more on the road than I end up seeing you in our own
we live in the same
20-mile
city.
radius
Yeah.
to each other. So it's always fun. So with your journey into healthcare, kind of now more on the marketing side of it, what do you see as just some of the major trends over the past year that you think are just really taking our industry by storm?
Yeah, it's the marketing side of things is really more about education now.
Mm-hmm.
Companies realize that it's harder and harder to get face time with health systems and really anybody in healthcare, and what they have to do is make their time worth it. And so if they can teach somebody something new, if they can educate, they can engage, or they can inspire, then they can build business. And so that's what we're doing at MarketScale. But the side benefit of that is, as the leader of the healthcare vertical, I get to learn about the cool things that are happening in healthcare, innovation, AI. You hear these things at the shows that we're at all the time. But I was at an event last week, and it was about, the name of the event was Patient at the Center. And I think we're seeing a tangible shift to putting the patient at the center of care and understanding that nothing happens with the patient without the provider, without the clinician, the caregiver. We've said those things for a long time. But I think what we're seeing now is, if we can't improve the experience for the physician, for the clinician, and the patient, the experience, the access, the outcomes, it's not going to be what we want it to be, what it needs to be. And I think the words that we've said for a long time are coming into fruition, and we're seeing some of that take shape now, which has been why we all got into healthcare, right? That's why we're here.
Right. And I think it's really been interesting to watch that patient-centric care starting to take place in clinical practice. Now we're just dragging reimbursement along, being like, yes, you need to reimburse and pay providers and hospital systems with that patient-centered care in mind versus all the siloed approaches that it takes today.
Something I heard the other day, and I agree with, is like, reimbursement has always been a challenge. Like, you're always chasing the rate, you're always chasing the fee schedule, you're always having to fight these denials and these rejections and things. You may as well make the patient better while you're, you know what I mean? Like, you're gonna
as well make the patient better.
You're gonna be fighting the same fight,
right?
And instead of chasing the dollar, which you're always going to be chasing, refocus on the patient. And then the battle for the reimbursement, the battle for the dollar is always going to be there.
Yep.
Whether you're putting the patient there or not, at the center or not. And so it's almost like it's an evil that we have to live with. And the focus on the patient doesn't change that battle. So you may as well focus on the patient too. And so I thought that was like, yeah, I mean, it's understandable. We have to keep our doors open. We have to get the dollars in. and the payers need to pay what they're supposed to pay and all those things. But that's always going to be a fight. That's always going to be something that we're battling.
So we might as well improve health outcomes
exactly.
along the way,
Exactly.
knowing we're going to be fighting dollar for dollar no matter what.
Yeah. On that patient-centric side, what, if anything, are you seeing around continuity or centralization of patient information, health records, right? Which is, all of us have had our own versions of this journey, right? But when we, our companies have multiple channels that we're in. And so when we're talking specifically around our virtual health company, when it's all under one roof like we have, and granted, it's a very different setup than like just a normal health system or whatever, in the sense of our physicians and our mental health clinicians and even our dentists can all transact within that platform. And so there's some level of ability to have some continuity to access to information. But, kind of in the rest of the world that we all transact in, we all know how frustrating that is. And not just frustration for us is that journey, but also where we're missing things, where you're talking to your general physician about something, you may have talked to your counselor about something. Nobody kind of connects all of those dots. We have a huge footprint in dental as well in our parent company, and we talk about dental medical integration and things that, when we talk about just technology in general, seem like, wait, that could have been done for us. It's not for lack of technology, right? It's for a lot of other reasons. What do you see happening there that's hopeful? If
it's hopeful.
No, I think, look, like there's no shortage of data and there's no shortage of apps that patients have access to, but they're all over the place.
Yeah.
What I think is a cool idea, and I'm not saying there aren't risks here, but there's risks with everything. We just have to identify what's acceptable or not. This analogy, I think, is a good one. When you go book a flight, they don't need all of your information for you to book a flight. They don't need your dad's flight history. They don't need to understand other things about you. They just need the information they need to book your flight. But for some reason in healthcare, well, not for some reason, we know the risks in healthcare if we don't have all the information, but the access to care that a patient needs is oftentimes bottlenecked because we're saying, look, we need all the information before we let you book this appointment, when in reality, a large majority of the time, we don't need all of it. I don't need all of everything for you to go see a specialist, right? I need some. And I think some things that are happening right now that are opening access, improving the experience, and still getting the care and the outcomes that the patient needs is saying, okay, look, like, let's be smart about this. Let's get the information we absolutely need so that we can get you to where you need to be and the care that you need to have. But I'm not going to sit here and make you tell me your mom's maiden name so that I can, right? We can be smarter about that. I think you're starting to see that trend a little bit, where it's like understanding the risks, putting things in place to prevent really bad things from happening. But what do I absolutely need to get you what you absolutely need?
I think you've also started seeing a lot of that in how people are trying to implement AI into the medical practices, where within the consultation, if the doctor is recommending a certain prescription, it can then flag because it's been listening to your entire consultation. Oh, don't forget you have to ask these 3 questions, for instance, to make sure there's no negative known side effects that are likely to occur. Like if you have a history of depression, that's going to change what medication I'm going to put you on. But, let's ask the common ones based on just prompts. So doctors aren't even having to necessarily remember this litany of information. The tools are becoming smarter for them.
Yeah, they already had an experience recently at a physician where they came in and said, first thing, hey, we now have this tool.
AI recording.
It's going to record everything. And so just know that it's happening, which I didn't personally have a problem with. So we have the consultation. There was a short-term prescription that he wanted to prescribe, and hey, let's follow up in 6 months. And I got a alert on my Apple Watch as he's talking, and my pharmacy already had the prescription order.
No way.
And I wanted to stop him, but he was kind of on a roll, right? With like next steps.
Like, I want to ask all the
and
questions.
So, but I also was like looking at, I'm like, he probably thinks I'm like ready to leave because I'm looking at my house. I'm like, there is no way that prescription already got submitted.
Wow.
Then when I'm leaving and I go to kind of do checkout, the front desk said, so what does whatever the date was, January 19th look like for you? Because that's what the system wants to schedule you into for your follow-up based on what you guys just talked about.
Wow.
And I thought, wow, there is, now for some people, maybe that freaks them out. I don't know.
That doctor's office
but it talks, what I took from that is, yeah, cool tools, all those things, smart people that can make that happen. It was more being the patient at that point going, right. So that's what it's like when at least under that roof, everything really is connected.
Yeah.
Even though I know that AI tool wasn't running their scheduling system.
Right.
It was just communicating with it.
Right.
So it doesn't have to be all things to all people.
Right.
And it also isn't their electronic prescribing platform. It just gave the right information to it. And I walked out the door, obviously with no paper, everything scheduled, script already at the pharmacy waiting to be filled. And it was just happened through our conversation. So like there's some cool stuff to it. Like as a somebody who was
like
able to experience that as a consumer.
Yeah.
It's like, okay, that was pretty cool.
Yeah.
And it wasn't even, to your point, I'm sure if it was some, something they had to have,
medication,
whatever, that they would have flagged that.
Right.
And I think there's, so much positive. And I'm obviously not a clinician. I'm sure there's opinions around that, but it was a pretty cool experience. Actually.
Yeah. I mean, like think about how drastic of a change that experience would have been compared to all the horror stories that we hear, right? About how long it took to get your prescription or how, inconvenient your next appointment setting was and finding a scheduled, like that's what AI in healthcare is enabling. We hear it all the time, but when you experience it, I hope we start to recognize it as, oh, there's progress. You know what I mean? Because I think sometimes it becomes so assumed in our other walks of life. Like if you're ordering off of Amazon and AI is telling you what also you usually order, and like that experience is so natural to us. Hopefully we're seeing that, like when this happens in healthcare, we're going, yes, like that's what it's about. We're finally getting there. We're making that progress. Yeah. You were like pleased by the experience, and that hasn't always happened in healthcare.
And actually there was yet another step to it, which was then I had a kind of a consult summary that entered into the portal at this place. And it wasn't the script of our whole conversation by any means, but it was a really well done summary.
Nice.
That I know nobody touched. Nobody had to create it. It was created based on the information. So when I was able to go back and revisit it, luckily it was pretty run of the mill stuff, but having parents that are getting older, or sometimes if it is a big deal, you're missing stuff. We went to an ER, but here's the other example, the not great example. Was
there's always those.
Well, and again, I think that was kind of one of the catalyst for my question was, so I had somebody that had to have a procedure done. It didn't relatively routine, but there were some complications as a result. Landed them in the ER. That then landed them to a transfer to another ER with a neurosurgeon that looked like there was going to be maybe one of the most invasive surgeries I've seen happening in the next 8 hours. And it was within the same system, and nobody knew what had been discharged, to the point of, hey, don't give this person their next blood thinner dose, because there's a chance for this. And they came in and were about to give them their next dose because they hadn't communicated that yet. And it had been like 30 minutes.
Well, and just also be glad that you guys were there monitoring that situation, because if you're not feeling well, they would just take it.
And again, things happen. I'm not trying to be critical of that clinical environment, because at the end of the day, they were incredible with the care that they gave them, and how they tracked it and avoided this really invasive surgery. So there was a lot of good that came out of it too, but it's the basics, right? It's like this person just said, don't do this. And 30 minutes later, this person almost gave it. It wouldn't have been life-threatening, thank God. But it's like that stuff should be a little easier. Waiting on the records. We're waiting on the records that you just had at a partner facility 2 hours ago before we can meet with this person.
Right.
I'm like, that doesn't seem like
that's
that
the
go over and
experience,
right?
photocopy.
It's not very patient centric.
No,
right?
you're right.
So
Some of our dentists in the dental network on our parent company side still want faxes. So
yeah,
good luck
it
with
happens.
that. So you could have just asked for the fax of those records, and
There
it
you
might have
go.
been faster.
It might have been. It might have been. But
So I'm going to pivot a little bit from faxing, which is like terrible old school technology, to virtual care. So, David, as you've had such a wide variety of different people you interact with, where do you see virtual care fitting into this health ecosystem that exists 2026 and beyond?
Yeah, I think the biggest, like, I don't know, the thing that's opened my eyes a lot about virtual care is it's not, as a parent, I see it all the time. Kid's sick. We live out in the middle of nowhere. Virtual care is great for them. Gets them what they need. We get the prescription we need, and we don't have to drive 45 minutes into. So that's the virtual care most people are aware of.
Mm-hmm.
But what we see more and more of is virtual care in different settings. I'm talking about like cardiology and radiology and neurology. Like there are highly acute settings where virtual care is opening up access to patients in the middle of nowhere, like me and my family. If you drive about 70 miles west of here, they don't have certain specialties.
Yep.
Right.
We're in downtown Dallas right now, for those that don't know, and he lives in Brock, Texas, which I think we found out has a strip mall.
That's right. That's right. And a restaurant. Yeah.
And a restaurant.
Big times.
Not multitudes of specialties of doctors.
Right. And so, but companies like Access Telecare,
mm-hmm.
and they're helping these hospitals deliver the care to the patients that they have in their facility without having to transfer them 45 miles away or delay the care that they need. They have access to these. And so that's the side of virtual care that I don't think people really understand, is like the technology, the access to resources has gotten so
mm-hmm.
great that really, no matter what you're working through, no matter the severity of the issue, like because of innovation and great services and great technology, you can get access to the people you need, to the care that you need, wherever you are. And that's cool, because people don't think of it that way.
I mean, it's like all the specialists are at your fingertips. And I was watching some study, and I can't remember the name of it, where it's even surgeries are now being able to be done completely remotely, where they have nurses and an
mm-hmm.
anesthesiologist in the OR in a rural setting. Wow. But then the surgeon is operating the remote device.
Holy cow.
From a completely different physical location. So I don't know how soon patients are going to be super on board with that, but the case that they were referencing was someone who could not travel. Like there was no way to get them from where they were located to a major medical center. And those devices are very expensive. They were just fortunate to be in a hospital system that had the tools. But how cool is that?
Yeah. Well, there's so many examples of this, right? People think second opinion, and that's a great avenue for virtual care. Is let's have somebody that's a real expert in this just review the case. And then sometimes that's in real time, right? Great. Sometimes it's kind of a asynchronous. They'll look at it later in the night and give it back. That's all great, right? And useful tools. But even things I've read, how technology and all of virtual access is innovating even things like clinical trials, and how fast it's able to screen and pick and interview and get the right people connected to say, man, you really are a good candidate for this. Something that used to take 6 months can now take a day to just know, are you in or out? Do you qualify or not, to at least get to the next phase? I mean, there's so many tools, ways that the tools are being applied that we don't think of. We think of it as the, urgent care type. I've got something that I need.
And I would say, so David and I were at Health a little while ago, and they had someone speaking on clinical trials, including Rob Lowe is a big advocate for clinical trials. And they are using virtual care for a lot of the follow-up appointments. Because previously, if you wanted to participate in a clinical trial, you would have to go back to the facility on almost a daily basis to get blood draws, get your numbers run, speak with the nurse about how you're feeling. And so there was a huge barrier to people wanting to even participate in a clinical trial, in which why you hear on the news, there's going to be a drug on the market that's going to do this. And then it takes 5 years before it can get out of the clinical trial phase, because there's a stigma to participating because of what they think the the participation effort's going to be.
Yep.
And telehealth and different virtual care mediums are driving down that barrier. Now it's more just about advocacy to those that are going through something to say, hey, research clinical trials, they're not as cumbersome as you probably have in your brain.
Right.
And a lot of the times the placebos aren't as common in clinical trials. That is already being tested with everyone else in the general population. So they really only need to test those on the treatment plan.
Wow.
So it was just fascinating and does not touch anything we do directly. But I was like, okay, I'm going to ask about a clinical trial if I ever get a crazy diagnosis.
Yeah.
Because that doesn't sound hard.
Right.
Right. Yeah. And most people want to be in their home, if they're going through something like that, and that gives you the opportunity to do that. So yeah, that, like virtual, like think about how far we've come in this space. We were fighting for reimbursement during the COVID time. Now it's like, it's a huge benefit to these providers. It opens capacity. It's almost like an additional revenue stream. And it's such a vital part to the whole ecosystem now, when just 5 years ago, it didn't feel that way. And now it's like, it's table stakes, you got to have something.
Yeah.
Yep.
I think people that don't incorporate virtual care into even their personal care journey are missing something. They're missing some of that ease and convenience of how they can be living their lives more effectively. Not effectively might not be the right word, but just peacefully. And
Right. It's definitely less disruptive. Yep.
That's the biggest thing. Like, inconvenience will keep you from getting the care that you need. We're all busy. Also, you got to think about the financial aspect of it from the patient side, and virtual health, telecare takes a lot of those barriers away.
Right. Just, think about people that are more in different types of jobs where, the economy is just tightening everyone's wallets. If you're going to miss a day of work and you're an hourly worker and don't have PTO built in, that's significant. So if you are able to get your medications faster, to get back and feeling better, to go provide for your family, that's a huge benefit.
Yeah.
Versus still, I think there's a lot of people that think their first point of entry is the emergency room.
Right.
Which should definitely not be people's first point of entry. I like the emergency room is there to check off that you're not going to die today.
Yeah.
So if you're going in for the sniffles, you're definitely not going to die today. So you're overpaying for your cold.
Well, and you mentioned it, I think, earlier, where all of that can absolutely be true and be helpful. But at the same time, if it's done effectively, you're freeing up in-person treatment for those that really do. None of us are advocates that virtual replaces anything. Nope. It's another tool, right?
Yep.
But if the domino effect is that now that clinician does have more time. Yep. I had an example during COVID and coming out of it with somebody that I knew that would have a procedure done every couple of months and then would have to go in. I think it was 4 times in the next 10 days.
Oh, wow.
And really, and they're challenged to get out and about. There's some physical stuff that makes that not super easy. And really those 4 visits, if I recall right, I think it was 4, they walk in, how are you feeling? Great. Any repercussions? No. Okay, we'll see you in 3 more days. And they would leave. And it was a 2.5, 3 hour turnaround to do all of that, right? Well, COVID hits and all of those moved to a virtual visit that took no time, 10-minute talk. Yep. They actually asked more questions and had more conversation because they had the capacity to. And I, being in this space, thought, they get it.
Yep.
It's like we force people into working smarter
by
having a global pandemic.
2.5 years later, they went back to the in-person.
No way.
Yeah.
That again, makes my heart break.
But for who knows what reasons, but they did. And so now it's back to the way that it used to be.
What would be some of the reasons?
I would be so curious if your answer is no, like, are you immediately getting hooked up to something?
No, not in this case.
Oh,
but
I think about all the additional risks that, somebody in that physical condition who's been through a significant procedure, having to get into a car.
That's exactly it. Yeah.
Be exposed to other people with germs.
Right. I mean, the slip and fall, the car accident, the germ. I mean, which the outcome part of this is like a big part of this. And especially with all these like value-based models nowadays, like if this person had a knee replacement or whatever, and they slip and fall in your facility because they had to come in for this follow-up appointment when it could have been done at home, like you're taking a huge hit on your value, your quality-based metrics. And so like that's a risk. I bet I would be interested to know if like they're reconsidering that or may have already
I don't know.
reconsidered.
I should find out.
I don't know. I've personally advocated for one of my son's doctors. I was like, we do not need to come in until after I've done a blood draw, because if his blood is normal, you do nothing. And if his blood is not normal, then I need to see you. And he was like, well, that's the reverse of what I normally do. I see you and then I order the blood work. I was like, but can we just pivot this whole situation so I can avoid a drive? We live in Plano, downtown Dallas. Depending on the traffic, can take an hour.
Oh, yeah.
And I was like, I would really like to avoid an hour once a quarter.
Yeah.
If we can just go get a blood draw, you read the results, and we can do a televisit if needed.
Interesting.
Saves so much time. And this is one of the head people at Children's Dallas, and I love that they're advocating for it. We love their head of telehealth over there is a great friend of ours through the industry, but it was like patient right here that is advocating for please make the situation just more streamlined.
Yeah.
Yep. Easier, more convenient.
But what's cool about all of those, right? Even in the midst of maybe frustrating circumstances, is the technology is there to serve it. Which is cool.
Oh yeah.
Mm-hmm.
At least we're not fighting a double-headed monster where it'd be cool if it was like this. Well, that doesn't exist. Then there's more of a battle. But for these solutions to be out there, should be thankful for that too. So
yep. And that's where
that process, right?
It is. And I think like you're right. The innovation's there. Some cases it's an education thing. Like other times it's the reimbursement models catching up with the innovation. But I'd like to get your opinion on this too. Like the adoption of the innovation, like that ramp has significantly shortened compared to where we were 5 years ago, where like the facilities, the clinicians, they're open to it now. Now they need to know that it makes business sense and that it's going to impact change and all that stuff. But like their ears are open, their eyes are open now. They're not saying no for no sake to innovation and to transformation, because like necessity is the mother of all invention, and it's needed. Yep.
And I think that is probably the highest contributing factor is you either start doing it now and get your head wrapped around it. And yes, all those other boxes have to be checked. It has to make sense, has to be compliant, has to be secure, has to be financially feasible, all those things, right? It has to be good for the patient, all of those things.
Clinically correct, yeah.
But there's a lot of those that check all those boxes.
Yep.
And so then it really is just, are you going to do it as disruptive or undisruptive as it may be to your current way of doing business? Those around you that are adopting it faster are seeing and reaping those benefits faster. And so they're either going to get on board or it's going to be a struggle, I think.
We can go full circle of no matter what, you're going to be chasing the money down for your patients. But if you're able to clinically effectively see your patients in less time and spend less time with the paperwork that goes along with it or with a lot of the research, if you can have AI pull up, oh, these are all the things you talked about, here's the potential diagnoses. If you can save that person time, that doctor, those different types of clinicians are going to see more patients, have more reimbursable events.
Yep.
Adding AI into the clinical setting also has increased the number of CPT codes that are billable per encounter. So they're seeing more reimbursement happening. So doing all of this, enacting technology and providing better care is at the end of the day going to start seeing those financials increase. And with the provider shortage that's going across in the United States, you kind of have to throw technology in there, right?
Yep.
Otherwise, we're going to be having exorbitantly long wait times beyond 3 months that we know in some areas or longer. That's just going to get worse as more clinicians retire, less are graduating out of school that stick with the profession.
100%.
So it's technology's got to play a piece.
Well, and at the end of the day, it's not replacing, at least I don't feel yet, maybe your clinical or robotic surgery may be a different game changer. But, the reality is every clinician I know got into it based on several factors. One was a calling. They felt like that's what they wanted to do. But at the core of all that is that patient interaction. I want to help people. And if these tools are doing what they need to do, which is giving them more time to help their patients in a more efficient, not in a negative spinny connotation of the word efficient, like, oh, now you're going to have to see tons more people because you're going to churn through it fast. No, like if you can spend more time doing the thing you were called to do with that person, and you've got more time to do that, and you're not as pressed to do all of the other administrative tasks.
Your head's not buried in the laptop.
Correct.
In the record.
And you can sit and have a conversation. I'll tell you the example I gave earlier that I had, I didn't really, noticed this in real time. It was the assessment of that visit as I was driving away that I realized what I appreciated in reflection in that was that kind of exactly what you said. Past visits to this clinician, he was typing in his stuff, right? And what this appointment was, and again, in real time, we were talking about stuff. I don't think I really realized it. What he had next to him, his whole setup had changed. He was sitting directly in front of me like we are. And to his right were some scans and things that he was looking at. And then we were having a conversation because it was doing its own thing as far as notation and all of that. And I feel in the, I don't even know, maybe 15 minutes, 20 minutes that we were talking felt like an hour because we were covering a lot of ground. Yeah. And in hindsight, I thought, man, that has to, I'm actually going to ask him. I have to go back to him in a few weeks. I'm going to say, listen, let's do the health stuff and then let's shut it off because I want to talk to you.
Like, what are you using?
It's
Can
like
you give me
all the
5 minutes?
information,
I actually, what I'm going to ask him is, how do you feel about more of this as a result of that? Right?
Yeah.
Just, is it what I kind of put this narrative on that maybe doesn't exist? Or do you appreciate more of the ability to just connect in a way that doesn't have something as simple as I'm going to have this keyboard and I'm going to see half your face because I'm going to look over this way when I, it's got to be great for these folks called to do these things, right?
Are you saying artificial intelligence is like helping us be more human?
I'm going to say yes to that.
Yes, unless somebody wants to use that negatively, and then I'm going to say no. I don't know.
I heard it at Health more than once.
Yes.
And I was like,
it is. Well, I think it is allowing people to get out of the legal requirements of their profession to actually engage with patients.
Yeah.
So kind of coming full circle, David, any final thoughts you have about the healthcare space, virtual care in general before we wrap for today?
I really do think like we're in the golden age of healthcare. It's still like there's a lot of things that are broken. Healthcare gets a bad rap, man. And it bothers me a little bit because there's reasons for it. Like there are valid reasons why healthcare is behind other industries. And we've talked about some of those reasons today. But I think what you're seeing is really inspirational focus on the patient and on the physician, on the caregiver, on the clinician, which is what it's all about. And, these efficiencies they're going to help with the cash flow. They're going to help with the margins so that we can keep our doors open and be successful businesses. But it's really an inspirational time in healthcare. And every conversation I have proves that. You go to Health and it proves that. And I'm glad to see it. I think the entire community is getting on board with it because those that aren't are getting left behind. Yeah. And so like no better time to be in healthcare. Have ways to go. There are still things that, are a problem, but the last 5 years have been a rocket ship.
Yeah. It's been a fun industry to be in. Also, David, I want to give you an opportunity to plug your own podcast while we're here for those listening. Yeah.
Yeah. Highway to Health.
Highway to Health.
Yeah. We talk about access to care, experience while getting the care, outcomes for those patients. And we just celebrate the people and the organizations that are committed to that journey. And Careington's been on, Dialcare's been on. So thank y'all for being there. And it's fun.
Awesome.
That's
well,
great.
David, thank you for the conversation. And thank you all for joining us on Dialed In on the Virtual Care Journey. Please follow us wherever you get your podcasts. Like, subscribe. Thanks so much. Have a good one.